Hello, I'm Dr. Molly. I'm a naturopathic doctor, and I am really passionate about helping to educate and empower women and expand the options that we currently have in women's healthcare. And so today we're just going to kind of be nerding out about a test that I run quite frequently in my practice on my patients called the Dutch test. So the Dutch test stands for Dried Urine Test of Comprehensive Hormones, and it's ran by a lab called Precision Analytical. And so today we're just going to kind of go through a sample report, and I just want you guys to see kind of what your results would look like, what things it tests, what we can interpret from it. And then, yeah, it's just another tool that you guys know is out there. And if you have any questions about it, feel free to reach out. I'm happy to chat about it a little bit further one-on-one. So the first page just starts with looking at our sex hormones and our adrenal hormones. And so this nice box here just gives us a little key on how to interpret the results. And so anything that comes back in this purple area is going to indicate that hormone that was tested is showing that it's in the postmenopausal range. And anything on this green arch would be what we would expect a woman of reproductive age hormones to show. And I will note that you can run this on men and women. This test is on a female, but the male report looks quite similar, and we just interpret it a little bit different, obviously. Okay, so we look at sex hormones, and so the first one we look at is estradiol. This is our E2. This is the estrogen that should be most abundant in our reproductive years. And then we look at our progesterone value, and finally the testosterone value. And then the second box, it shows our adrenal hormones. And so you guys may have heard of cortisol before. You may have heard of your adrenals. We have two adrenal glands. They sit on top of our kidneys. They're part of our endocrine system, and they secrete this stress hormone that we call cortisol. And so with this test, you'll get a measure of your free cortisol, but you'll also get to look at the cortisol metabolites, which can actually tell us quite a bit more. And so I'll just note this free cortisol that you may have had tested before. So you could do this, with a salivary test, with a serum test. This only makes up about 1% of all the cortisol in your body. And so why that can kind of be a nice little snapshot of what's going on or kind of prompt more investigations, it's not going to show us the whole picture. And so what's really nice about the Dutch test is it goes, a few steps further and shows us those metabolites of cortisol. Anyways, so we'll start looking at this graph. So cortisol, we want to rise as we wake up. We want it to kind of peak, mid-morning, and then we want it to start gently falling throughout the afternoon, ending up pretty low in the evening, which is going to allow us to fall asleep and get that good, restful, restorative night's sleep. When cortisol falls, it allows melatonin to rise, and that's obviously going to be our sleep hormone, which is going to, again, help us sleep through the night. And so you can see on a patient result like this, where the patient's values is represented by this red line. And so you can see this person's values are very low. They're still kind of getting that nice little peak, but it's very low, very baseline. So this is someone who's going to be pretty exhausted, maybe feeling really burnt out, might have a hard time getting out of bed in the morning. And so there's definitely a lot that you could do for someone whose test results is showing this. But yeah, so this person needs some support. So that's the daily free cortisol pattern. And then, like I said, it's nice. It gives this metabolized cortisol value. And so what's really interesting about this is you can actually interpret a little bit about the thyroid if you get kind of unexpected results on these two gauges. And so, the way I remember is if the arrows are facing away from each other, that's kind of a clue to us that probably we want to investigate the patient's thyroid for hypothyroidism. If the arrows are facing towards each other, that might be an indication that we need to consider maybe hyperthyroidism, maybe some liver dysfunction, maybe some history of disordered eating, etc. So it doesn't measure thyroid directly, but it gives us a big clue of some stuff that we might want to interpret and investigate if we're seeing that. And then finally, the last value on this first page is this total DHEA production. DHEA is an androgen in our body. It decreases with age. It peaks, later 20s, early 30s. And so we want to see this, adequately high, but we may see it a little lower based on your age. Yeah. So that's the first page. The second page is a whole bunch of numbers, which I kind of always breeze over because on the third page, it's the second page just in picture form. So it's a lot easier and more fun to talk about. And so this third page is going to go a little bit more in depth about the sex hormones. You can see here at the top is pregnenolone. Pregnenolone comes from cholesterol. And pregnenolone then goes down all these pathways to produce our steroid hormones. And so if we focus on this white box first, this is going to be our androgens, which are more of those male sex hormones that we think of, like testosterone primarily. And so you see we see that DHEA again. So there's a few things I look at this box. First, I look at the conversion of DHEA to DHEAS. DHEAS is the inactive form of DHEA. If we see someone have really high levels of DHEA or, moderately elevated levels of DHEA, or within normal limits, but on the higher end, and then we see a really low conversion to the DHEAS, that can actually prompt investigation of some kind of inflammation in the body, possibly some blood glucose issues, some insulin sensitivity issues, some gut issues. There's something going on there that's preventing us to put the sulfate group onto the DHEA. And so that's one thing that we can look at. We also look at if we're pushing our androgens down this 5-beta pathway or 5-alpha pathway. And so if we're pushing too much down the 5-alpha pathway, as shown in this example report, you can see here their arrows a little bit red, a little bit high. If we push down this pathway and this alpha pathway is being overactivated, we're going to see really concentrated testosterone in our body, basically. And so this is going to give us all of those side effects of too much testosterone. So, when we're talking about women's health, this can be quite common in women dealing with the condition polycystic ovarian syndrome, PCOS. It can also explain why some people get that jawline cystic acne. Some women will experience, unwanted hair growth. Usually the hair is really coarse. It can be on your chin, your lip, maybe your chest, abdomen, kind of those places where men tend to grow more hair. We'll see women growing hair there if they're pushing too much down this pathway. We can also see, male pattern baldness. We can see really high libido. All of these things that are going to be associated with too much testosterone. Really agitated. That's a really big one too. Women will feel just really agitated, really upset quickly. And so it's kind of interesting to see it on a test and explain to women like, no, you're not crazy. Your biochemistry and your pathophysiology is influencing that. And so something that can be corrected, and it's empowering to know that it's not all in your head and that there's reasons behind some of the symptoms that you're experiencing. Okay. Then if we look over at this progesterone box, this is gonna, first and foremost, it's gonna tell us this woman ovulated or is ovulating. She's not postmenopausal. Progesterone is our dominant hormone in the second half of our cycle. So after ovulation until day 1 of bleeding, the drop in progesterone is mostly what influences the onset of your menstrual cycle. And so this is really interesting. We like to see it at an adequate amount. If we see really low progesterone, that could explain some gut discomfort. So some really low motility in your gut issues, constipation. It can also be the reason maybe you're feeling really anxious. Progesterone's kind of our cool, calm, collected hormone. And so if somebody has really low progesterone or relatively low progesterone compared to their estrogen, we can see this anxious kind of mood dysregulation kind of take over, especially if you're noticing it during the luteal phase of your cycle. And then something so cool is the estrogen box. So you heard me in the beginning say E2 is our dominant reproductive estrogen. We also have E1 and E3. E3 is most often seen post-menopause. We make a lot more of that in our adipose tissue. Something that's also interesting about E3 is it's cleared from our body a little bit slower. And so if you measure this at a weird time in your cycle, sometimes we can see E3 be a little bit higher in women. If there's some kind of liver dysfunction happening, we can see that a little bit higher. But yeah, this is so cool. This is one of my favorite reasons to run the Dutch test. So I like to orient people first by saying this is all happening in your liver, right? So when we have estrogen in our body, it binds to whatever receptors we want it to bind to. It does its job. We get all the benefits from it, and then we need to get it out of our body somehow. And so the way that happens is through our liver. So it kind of goes down 3 phases of metabolism to get out of our body. The first 2 phases happen in our liver and is shown on this test. So those are the 2 that we're going to talk about. The 3rd phase happens in our gut. It has to do with something called beta-glucuronidase, and we'll save that little talk for another video. Okay, so if we look at metabolizing it, so if we just focus on phase 1 detox, we're looking at these 3 arrows. So the blue arrow, the red arrow, and the green arrow. The blue arrow is going to be our proliferative pathway. And so if we're pushing too much estrogen down our proliferative pathway, it's going to give us every PMS symptom that you can probably think of. This proliferative pathway is going to tell things to grow if they're there to grow. So a lot of times we'll see really a lot of breast tenderness, maybe heavy bleeding, but it can result in anything, bad cramps, acne, just PMS symptoms in general. This is the pathway that's being over used usually. Then we have this red pathway, which is kind of the bad pathway. This is the one that's going to put us at most risk for developing estrogenic cancers later in our life. So those are things like breast cancer, endometrial cancer. If we start pushing down this pathway at high rates, it's going to push estrogen down something called the quinone pathway, which is going to result in some DNA damage, and DNA damage is how we get cancer. And so that's a no-go. We don't want too much going down that pathway. And then the 3rd pathway is our good pathway, green, good, and this is where we primarily want to be pushing all of our estrogen through. Now, that's all great. So say we have someone pushing most of their estrogen down this green pathway, phase 1's looking good, but then we look at phase 2. And as seen on this test, so this is a good example. So look how their methylation activity, which is indicative of how well their phase 2 liver detox for estrogen is working, is low. And so if that's low, it's going to block this green arrow. And when that arrow gets blocked, it doesn't matter if phase 1's working really well. You can have all the estrogen coming down this green arrow. But if this is blocked, it's going to sit here and it's not going to be able to get through. It's going to be like a traffic jam, and it's going to hop over to this quinone pathway and cause us all those dangerous side effects later in life. So it's something to check in on. This is also a great point as to why we test and don't guess what your issues are, because if we just go off of symptoms, symptoms are going to look similar whether you have a blockage here or you have an issue here. And we don't want to give something that's going to push this pathway down the good green if this is blocked, right? And so we really test, and then we know exactly, which pathway we're trying to influence in your body, and then we can get you feeling better. And it's preventative medicine at its finest, so it's preventing, those cancer risks later in life. I think that's all I wanted to say on that page. I get a little excited. Okay, then the next page, again, a bunch of numbers, but it's shown in picture form mostly on this page. So this is looking at that Hpa Access. Hpa stands for hypothalamic pituitary adrenal axis. And so this is cool. So we look at melatonin, which I think I mentioned on the first page. It's our sleep hormone. If cortisol is really high at night, it blocks our body's ability to make adequate melatonin. Side note on melatonin, it's really interesting. There's a lot of good research on melatonin and egg quality. And so they actually did studies where they looked at, antioxidants that are in our follicles, so around our egg. And they found that really healthy eggs that were likely to go on and make a happy, healthy baby, those eggs had higher levels of melatonin in the fluid. So that's pretty cool. But yeah, melatonin, we get to see the level here. It is a really strong antioxidant in our body as well as, that sleep hormone. And then we take a closer look at those adrenal glands. We see the DHEA coming over, and we also see further breakdown of cortisol metabolism. We can see if we're pushing it down this THE or THF pathway. And so that can give us some insights not the most useful measurement for me, but it's still something to look at. Give us an idea of what's kind of going on in your body. And then we look at free cortisone versus free cortisol, which is just that inactive form. And so we want to see those be equally correlated, or else we know maybe your body is kind of responding to some kind of stressor in an inappropriate way, basically. So that's pretty cool. And then the very last page is, some of you may have heard of OAT testing. It's organic acid testing. The ones that are included on the Dutch test are specifically the measurements that have to do more with our hormonal health and balance. And so we look at some of the vitamins that are important in maintaining that. And that's your vitamin B12 and vitamin B6. So we can kind of get an idea if those might be an issue for you. And then we also get this marker of glutathione. Glutathione is a strong antioxidant in our body. Super awesome to have around. Helps with all those reactive oxygen species that can be floating around everywhere, causing problems. And then it gives us some insight into your neurotransmitters, so dopamine and norepinephrine, epinephrine, which are those adrenaline hormone or adrenaline neurotransmitters. What's really interesting is it's really hard to measure, dopamine, but in the studies, they've found that this HPA kind of correlates with the actual amount of dopamine in our brain. And so we can kind of have a look at this. It can give us some insights into, mood dysregulation. You can also interpret some stuff possibly about maybe some genetic SNPs that you might have. Some of us, when we get really stressed, we release cortisol, we release this norepinephrine, epinephrine, part of our fight or flight, response. And depending on our genetics, it's going to influence how quickly we break those down and get them out of our body. And so it's interesting to look at these numbers and then ask the patient, like, oh, when you get stressed, do you feel like it takes you a really, really long time to come back down from that stress? Or are you someone who gets stressed, the stressor happens, and then you're kind of on to the next thing and you stop thinking about it? So it's just kind of interesting to kind of consider that correlation. And then, your melatonin, and then this, the last measurement's this oxidative stress measurement. If this is really high, we're obviously concerned about cancer in the body, but a few other things can cause that. And mostly we're just kind of checking in, seeing how your body's doing, with overall inflammation, overall oxidative stress. So that is the Dutch test. I talked kind of fast through that because I didn't want this video to be super long, but it probably is still really long. But yeah, thanks for listening. I hope you guys learned something. Again, if you have questions, just reach out to me and I'm happy to chat. Okay, bye you guys.